المفوض العام لمفوضية اللاجئين سيد دومينيك. How are you?
Very fine.
Okay. We want to start the interview with asking you about the finances of UNHCR as far as the Syrian refugees. How is it going? Do you have enough money? Are there going to be any cuts, and any services will be affected by the financial situation?
I think overall we are a little bit concerned, but we are not worried yet. What we've seen is that some of the agencies receiving humanitarian funding support, they have had interruptions in their funding. You remember last year there was an announcement by WFP that they had to reduce food rations. So there are some early warning signs. We also had in May, only 2 months ago, the Brussels conference, which, as you know, is the place where donors make their pledges. They, in a way, announce their support for Syria and the countries around Syria hosting refugees. And there, the early indications were very much in line with last year. So we are hoping that the big donors, the international community, that they will continue their support to the big countries like Jordan, who have so generously taken in Syrian refugees.
So your budget is basically covered, but we've noticed in the last year that there has been an inflationary cost rise in the cost of electricity, in the cost of food, in the cost of transportation. How is that going to affect the services rendered to the refugees?
Absolutely. No, you're very right to point this out, because in a way, all these elements you mentioned, they are like series of economic shocks to refugee families, to refugee households, especially those living in urban areas. So you first had, after Corona, you had a lot of jobs in the informal sector that disappeared. Then you had the increase in prices, the inflationary trend, the increase in fuel prices, and you also have utilities like electricity that has gone up very, very significantly. For some families by 155%. That is an enormous increase. And of course, that what it means is that refugee families have less with the same amount of support, but they have less ability to provide for the basics. And what really worries us is the beginning of negative coping mechanisms. What we mean by that is, for instance, when a family decides they simply do not have enough money to provide for 3 meals, so they have only 2. And of course that has an impact on the nutrition of their children. That has an impact on the general well-being. The fact that more and more families take their children out of school, trying to get them to work to support the family income. That's another negative coping mechanism. So we are very concerned about this, and clearly this is a situation in which we need to redouble support and also communicate that to the donors who provide funding for the refugees.
Now, the Jordanian government created a mechanism for Jordanians to get subsidy on the electricity, but this subsidy does not apply to refugees. So does the UNHCR try to chip in this area, or do you try to solve this problem in different ways?
So when the reform of the electricity sector was discussed between the IMF and government, it was primarily around leveling the different tariffs that were available to private sector and so on. So at the time, nobody immediately understood that there was one group of people, namely non-Jordanians, who previously had benefited from a subsidy and now would no longer receive that subsidy. So it came as a shock. It came as a shock to the people concerned, but also many of the agencies who continuously monitor the economic situation of refugees and who try to make sure that they are not exposed to such sudden shocks. So when we discussed that with government, there was an initial offer to extend the subsidy for 6 months, but only for the 25% of the most vulnerable. So we assisted in identifying those people, and we are grateful that this has happened. But honestly, this is only a band-aid.
When does it run out?
It runs out in September.
Wow.
So, and don't forget, it is only the most vulnerable. So
Sure.
it's 25% out of all the refugees who previously received the subsidy. So in a way, the impact for 75% is already there. And it will become even more serious when in September, just before winter, when the 25% will also lose that subsidy. Now, from our perspective, the way forward here really has to do with identifying those who are most vulnerable and who need special consideration.
And what is the criteria?
So ideally, it would be a determination of how vulnerable, how poor a household is, and then that subsidy is granted regardless of who that person is. That would be an ideal situation, because then you can be sure that the limited resources to provide such relief are really directed to the most vulnerable.
Now, health is a big, complicated issue. And we've been receiving some complaints that people with cancer, with dialysis and so on, sometimes the services from some of the hospitals is stopped. And there's the erratic, sometimes it comes back, sometimes it's on and off. What do you recommend, or tell us more about the health issue and especially the serious cases?
So let me start off with the really good news, the news that fills us all with pride and that makes Jordan such a shining example among the countries hosting refugees. And that good news is that Jordan has allowed access of refugees to the national system at the rate of non-insured Jordanians. So that is, as a measure, is quite remarkable.
Yeah, for sure.
Now, there are, of course, then differentiation. There's primary health care, but then there's more complicated cases that need to be referred to secondary and tertiary institutions. And that's where it gets complicated. That's where we have a limited amount of funding that we can use for those cases, but where we have to make really painful decisions. I mean, how can we morally...
You play God almost.
Almost. How can we morally justify that we have funding for this dialysis case, but we don't have funding for this cancer patient? This is a very, very difficult choice. We have very dedicated health professionals who are working in this field, who are trying to make that determination, but it is extremely painful. Because at the end of the day, we are dealing with real people, and in many, many cases, it is health conditions, medical conditions that urgently need treatment. Now, to your question, yes, there are some hospitals who operate very generous schemes of subsidizing refugees who seek treatment. We are really very grateful for that. Unfortunately, some of them, they are then a little bit erratic. So if they have contributions, then they're able to provide service, and then sometimes
so it's not obligatory. It's voluntary that they do this. This brings me also to the cases of autism and other cases. Is that also fall under the same, which is complicated issues? Do you have problems with the autistic kids?
You know, the number of children with special needs amongst the refugee population is more or less in line with the percentage in society at large.
11, 13%?
Thereabouts. So here, one important distinction is that whereas children in urban areas have access to some government institutions, in the camps you have some facilities that are still supported by the international community, where in some areas you can actually provide dedicated care. Our concern is that we want to be sure that overall in the delivery of that kind of support, that we reach that same standard that Jordanian nationals have access to.
It's better in a camp for some of these cases?
For some of those cases, because they really require specialist care and they require special support mechanisms, there's a better facility to provide that support.
Now, on the level of education, we've been monitoring the quality of education, and it seems that more than one result has shown that the level of education for Syrian refugees is backtracking.
Yes.
Do you have that same result, and what is happening about it?
We have, unfortunately, that same result, and that is one of the things that keeps me up at night. How can we reverse that trend? How can we help parents who mostly for economic reasons, make that very difficult call to take their children out of school. How can we make sure that those children who succeed, who have brilliant Tawji results, who are ready to join university, how can we help them make sure that they actually can pursue university studies, and of course after that find a job. Find a job, because, and this is a very, very powerful message back to the refugees, that look, there are ways. I can, if I give encouragement to my child, if I find a way to make it happen and see him or her through school, there is a way that they can progress and they can have a better life. And that message is so, so important for the parents here in urban areas, but also for the parents in the camps.
So tell us more about the scholarship program. What is available, how much, who's benefiting?
So we have a famous scholarship program. It's called DAFI, which currently benefits about 200 Syrian refugee students. Now, 200 out of a whole population of so many hundreds of thousands is nothing, is a drop in the ocean, if you will. But again, I want to emphasize how important it is that those opportunities are made available and that we are able to expand on them. What we are seeing now is that many donor countries, many embassies, they are also operating scholarship schemes. Some of them allow for studies here in Jordan. Some of them allow for scholarship to study abroad. So here we hope that there will be more coming on the market so that more opportunities are available. Let me also add one thing. What really impresses me time and time again is that refugees are not just waiting for some agency like UNHCR to provide this or the other. Refugees have initiative and they prize education. I was struck how many refugee children have earned academic scholarships from the university they apply to because they study hard. And that to me is really an impressive sign. It means that there is a community which is not just waiting for support, but is also trying very hard to provide for opportunities for their children.
Very nice. Now, the issue of the return and the resettlement of some refugees, how is that going? What's the numbers? Are there some returning? Are you still able to repatriate in third countries some refugees? So
maybe to start with the return of refugees back to Syria. There have been steady numbers around 2018-19. Then with Corona, with the lockdown, 18-19. No, it was, I think, 30,000 over a 2-year period.
Okay.
So it was some returns, still fairly limited. But with Corona, this has completely stopped. Also because the border was closed for a long time. Now I think there's also quite a few concerns about the situation in Dara, which is one of the main areas of origin in Syria. And we just have to see how refugees look at the situation. When we ask them the questions, and we do that very regularly, because we want to know what is their expectation, how do they look at the evolution in Syria. It is a very interesting result, which has been fairly consistent over many years. And it's very simple. The vast majority of refugees, more than 80%, they say, yes, we want to go back. But when we ask that same question differently, and we say, are you prepared to go back in the next 12 months? A similar magnitude, more than 80%, is saying, no, but how can we? Look at the situation back in Syria. How can we safely go back? So you see this dichotomy that on the one hand, there's a very clear intention that, yes, I do want to go back to my home, but really conditions have to be right. This is also an important message to Jordan, because, for Jordanians, sometimes it's almost too easy to say that, the Syrians, they enjoy their life here in Jordan and they will never want to go back. But no, if you speak to refugees, many of them, of course, they miss home. It's their home. It's where they were forced to take flight somewhere else. But as soon as conditions will allow, they will want to be back.
And third country, repatriation, how many are going every year?
So this one is called resettlement.
Resettlement. Okay.
So resettlement is basically when a third country, let's say Canada or another country in Europe, for instance, accepts somebody who has been a refugee in Jordan to move to that country. That is resettlement. Mm-hmm. So it is applicable to Syrians and other nationalities who are refugees here in Jordan. Now, last year, we've had 5,000 cases who moved from Jordan to third countries. Mm-hmm. Now, again, that is not a very large number, but it was a facility that has helped a number of refugees in really very difficult situations. Mm-hmm. For whatever reason, some of them with security challenges, some of them with very particular health issues. The fact that those refugees were allowed to third countries is also a sign of how other states are sharing the burden with Jordan. So we are hoping that more opportunities will become available. Mm-hmm. It is unfortunately not nearly enough. We have tens of thousands of refugees who we would want to consider for resettlement, but there are no spaces available to do so.
Now, UNHCR is responsible for all refugees, except for the Palestinians. What are the biggest challenges in the non-Syrian refugee situation in Jordan?
You see, in Jordan, the facilities, the rights, the standards that are available to Syrians are not immediately extended to refugees from other countries. So we have sometimes issues that a national, let's say from Yemen, comes to Jordan, maybe originally because he was looking for medical, or maybe he came to work and he had a regular work permit, everything was in order, but then something happens in his country.
Can't go back.
War breaks out, maybe there's forced recruitment in his village, his family is already locked up, and then he cannot go back. So the question is a little bit, what is his status? How should he be considered within Jordan? What kind of facilities can be extended to him? So that's an ongoing conversation with government, how best to support non-Syrian refugees and how best to allow that some of them may have real protection concerns, meaning that they fear for their lives if they were to be sent back. That doesn't apply to everyone. It's not an automaticity. It's not like everyone who says I'm a refugee is actually a refugee. You still have to go through the process of understanding what happened to you. Why can you not go back to your country?
So other than Yemen, what countries are the most acute cases of refugees in Jordan?
So we have, when you say acute, you mean cases...
people couldn't go back?
Yes. So we have nationals from Sudan, we have nationals from Somalia. We have also smaller numbers from other countries. But right now, I think it's the Yemenis, the Somalis, where there's particular concerns because of the situation back in their country.
Thank you very much. It was a very pleasant interview. I hope we can provide some good news to some of the refugees and the challenges that you have. God bless you.
Thank you very much, Daoud. Can I add one message?
Sure.
I want to direct a special message to all the refugees here in Jordan. And that has to do with the fact that many of you are hearing information about UNHCR, about opportunities elsewhere that are not really correct, that are circulating on social media, that suggest that maybe if now you fly to Belarus or tomorrow you go there, you have opportunities. And I just want to tell you that please check in with us. We are really concerned that you may take very important decisions based on wrong information. So we really want to be sure that whatever we know, we share with you so that you can decide for yourself what kind of steps you want to take. Thank you.
شكرا جزيلا. اللقاء.